What is it like to work as a nurse who floats across the ICUs in a hospital? Join me on a night shift as a CSO nurse. A CSO nurse is basically another name for a nurse who works across units in the hospital. In my role, I work specifically in all the ICU units at Rush University Medical Center. Tonight, I'm starting in 10 West, or the adult ICU. So I clock in and head to our team huddles. This is where we get updates on staffing and equipment. I receive reports on the patients I'm working with to better understand their current condition. I take a little time to introduce myself to all my patients and to start prepping for the night ahead. When I'm all set up, I'll start with my patient who needs the most care and assess them, providing meds if necessary. Then I repeat the process with all my other patients. Depending on their needs, I'll check in every hour or half hour. I'm gonna get that pillow and blankets for your son, okay? I'll add my assessment of each patient to Epic so the doctors and other team members have the best information to work from.
Hey Steve, you're gonna be floating to 11 West for the rest of your shift.
Okay.
You'll give your patients to Tara so you can give her a report.
Okay, sweet.
Cool, appreciate your help, man. Thank you.
It. My assignments are in 4-hour blocks, so I might float to 3 different units over the course of my 12-hour shift. It depends on the staffing needs that day or night in my case. I actually enjoy being in different units every day. It keeps things fresh and challenging. It's funny to think about now, but I became interested in the medical field at age 12 when I learned that my cousin worked 3 12-hour shifts per week. I was so impressed that she was able to watch all the Chicago Bulls games she wanted without work getting in the way. I went to Marquette for nursing school and then got a job as a critical care nurse at Rush. I love working at Rush. They tend to hire and retain great people. My coworkers really make the job what it is. I've made really close friends here, people I hope will be in my life forever. Rush is really invested in nurses' well-being and their education, such as tuition reimbursements, classes, and leadership opportunities. Cool, that should be all right? When you're constantly floating to other units, the biggest challenge is knowing your resources. I might be assigned to a unit where I'm not familiar with everyone and don't know who has what level of experience. But nursing is a team sport, so I make a point to introduce myself to my teammates, get to know the charge nurse, and get up to speed on who the physicians are. There's no time to figure this out during an emergency care situation. To make sure someone always has my back, I always offer to help with anything they need. That's helped me build relationships that always benefit me, my team, and my patients. I'm also never afraid to ask questions, even of the doctors. It's important to be sure we're on the same page and to understand the nurse's role in an intervention. Nursing is a 24-hour job. I have to accept that I can only get so much done during the shift. I just focus on getting my patients into the best possible state for when I hand them off to the next nurse. Shifting from unit to unit, the biggest difference is the amount and type of care the patients require. Patients in the ICU often suffer from chronic illnesses and need medications and machines to keep everything stable. But in the neuro ICU, I need to do Q1 assessments every hour, checking their pupils, asking the same questions they've been asked dozens of times before. All right, gotta ask you some silly questions. You've probably heard them a few times. Patients can get a little tired of us, but we have to pay close attention to the results of their assessments to see if there are any subtle changes that require medical attention. At the end of my shift, I'll finish all my charting and give a report to the incoming nurse taking over my patients. I'll clock out and head home to get some much needed rest. All right guys, that's it. That's the day in the life.